In this video, we will see about access opening and access cavity preparation of maxillary central incisor. In average, the total length of the tooth is approximately 22.8 mm in an average, and we should know about the anatomy of pulp chamber and pulp canal before any access opening. So the pulp horns usually follow the patterns of the mamelon, the developmental mamelon which is seen in the central incisor. The pulp horns usually follow it and three in number on average. And the shape of the pulp canal at the cervical third is usually ovoid. In the middle third will be ovoid to round, and in the apical third it is usually round. The pulp chamber usually is of ovoid in mesiodistal dimension. And the access cavity preparation, once it is finished, when you see from lingual aspect or from the incisal aspect, it is usually approximately in triangular shape with the base facing the incisal edge. So we have to aim for this kind of shape so that the axis will be a straight line axis. So what is the step and how to proceed from the beginning, let us see now. So the number of roots in maxillary central incisor is 1. As you know, root canal is also 1. And you should also pre-operatively take a radiograph and examine the pulp chamber and pulp canal anatomy of each tooth before proceeding. So the pulp chamber is ovoid mesiodistally as we saw before, and access cavity should reflect the pulp chamber anatomy. As I told, it should be verified with a pre-operative radiograph. Now, as a guidance, in the lingual aspect, try to divide it into 9 segments. The middle segment, that is the central part of the lingual side, is where you should prepare your access cavity preparation. Okay, so to mark the central point, we are approximately dividing it into 9 segments to check out the central point. So usually we choose a contra-angled handpiece and burr, usually round burr of small size, usually size number 4 or something, and aim for the center of the lingual surface. From there, penetrate the enamel. Here we should remember the size of the burr and model of the burr, and also the direction of the burr. It should be perpendicular, that is, to the lingual surface. The direction of the burr or the handpiece should be perpendicular. From there, after which we have to penetrate much more, but the direction of the burr should be changed. The handpiece and the direction of the burr will be such that it should be along the long axis of the tooth. From there, we are penetrating much more till we feel a drop in the burr. The drop is due to the penetration into the pulp chamber. So, as you see in this image, we have changed the direction of the burr along the long axis of the tooth. From there, you could see we will penetrate the burr till we feel a drop. The drop is because we are penetrating into the pulp chamber. So now you have gained access to the pulp chamber. Now we have to prepare and refine the access cavity so that the procedures of root canal treatment will be made easier and simple. For that, we have to remove the pulp horns palatally present and the remaining overhanging dentin and enamel. Without removing these parts, your access will be incomplete and the treatment will be insufficient because the lack of straight line access. So, as you saw in the previous steps, after removing the pulp horns and overhanging enamel and dentin, we need to enlarge the orifice. For enlarging the coronal third of the canal and chamber, we use Gates Glidden burr, and after enlarging the orifice, we refine the cavity. Access cavity preparation is finished. So after finishing, we will check for straight line access using Endo Explorer. If you could gain a straight line access, then your cavity preparation is almost over. So let us recap the steps what we saw. Before that recap, let us understand one more clinically significant point, that the labial cortex of the bone maxilla is very close to the labial surface of the root. Therefore, labial perforation is a very common iatrogenic error which you should avoid and keep in mind before preparation. So let's recap. First, mark the center of the lingual surface. Then, the round burr should be directed perpendicular to the lingual surface. Enter the enamel. Then, change the direction along the long axis of the tooth till you feel a drop in the burr. The drop is felt as we penetrate the pulp chamber. From there, overhanging enamel dentin are removed. Gates glidden is used to widen the access opening and the orifice is enlarged. Then straight line access is checked using Endo Explorer. These are the steps in the access opening and access cavity preparation of maxillary central incisor. See you soon in the next video.